Hello. Well, March certainly is coming in weather-wise like a lamb. The world itself is not. And today we are worried and fearful and prayerful for the people of Ukraine as we continue to watch the devastation that's happening. On the other side of this conversation, of course, is the tremendous courage of the Ukrainian people. We have very large communities in South Jersey and in Philadelphia of folks who have emigrated from Ukraine and who continue to worry about their loved ones and have family and friends that they continue to stay in touch with and pray for. I'd ask you to add your prayers and your hope for peace. Here are some organizations that are taking donations for Ukrainians and their safe passage. We are so grateful to the countries of Poland and others that are welcoming the refugees in, and I know that you join me in making sure we support our communities as well as the Ukrainian people. COVID has continued to decline. We are under 50 patients across our system and under 1,000 people who are hospitalized in New Jersey. This is the lowest that it has been in certainly in 2022, but in the larger part of 2021 as well. And you see constant conversation about what is and what isn't. My request of you is to consider that people have to make their own decisions. There are indeed people who are immunocompromised or are caring for people who are immunocompromised that will continue to wear a mask, and those that don't have that concern and will take them off. And regardless, I think being respectful of people's decisions is the right way to go. March is National Nutrition Month. We have tremendous services here at Inspira to make sure that we help you with that nutrition journey. And we know that eating well and having access to the right foods is a big step in that, making sure you do have a healthy heart. So please feel free to reach out to us, and we're glad to walk that journey with you. So we had lots of excitement this week with our kickoff at the Gloucester Township EMS program in Camden County. We met with the mayors of Pine Hill and Gloucester Township, and we will be providing EMS services there. And we're very, very excited about this partnership. It really was wonderful to be with both mayors again and the chief of police and the entire crew there. Everybody was so welcoming and so exciting. And again, it's an honor to serve those two communities. You know that we've been working very hard on the Woodbury redevelopment. You know, so much has changed since the first plans were announced for us to move to Mullica Hill over that 5-year window. We are seeing redevelopment happen through Woodbury, and we actually have decided to take a pause and move forward on a request for proposal that will be going out to developers. The developer that we've been working with, Endeavor, will be applying, and we look forward to hearing from them as well as others as we continue to consider what's best for the community and for that location. We will continue to remain there. We have a proposal in before the planning board for our satellite emergency department, as well as the movement of behavioral health beds, which exist in Woodbury today, to go over top of that location. And in addition, the community leaders have asked us to move our EMS building to have all of those things in one location, which we are glad to do. So that proposal will go before the planning board as we continue our work on the redevelopment. You know, so I'm always surprised by the things that people take note of when they're in the hospital, and they actually take the time to write to me about. And in this situation, we had one of our patients who actually submitted what we call a DAISY Award, which is a recognition for somebody who goes above and beyond. And today we are recognizing Ryan Ruiz, a nurse who really touched this patient, not just by the clinical care that he gave, but by the little things he did. Making sure that when his glasses broke, he found a way to fix them, making sure that he was attentive to just the right foods he needed to eat for his diet. All of us expect to get good care when we're in a hospital and be able to be healed, but sometimes it's those things that we take for granted that we can just do when we're home, making sure we eat the right things and have access to our shower and, pull out our little kit to make sure we can fix our glasses. But when you're in a hospital, you don't have access to those things and don't have control always over getting those things taken care of. And so, Ryan, we thank you so much for touching the patient in this way and making sure that we were able to accommodate their needs and make their stay just that much more special. And that's really the goal. Not everybody will have the same requests, but being able to listen for those requests that are unique to them and important to them is really what makes this journey and this trust that we develop along the way so very important. So until we meet again, be well and stay safe.